you have psoriasis? Do you have arthritis? Do you have psoriatic arthritis? This is Diamond Fernandez here with the Heart Fit Clinic, your leaders in heart health. And today I want to talk about these conditions and how, if you have psoriasis or psoriatic arthritis or even arthritis, this can lead to heart disease. And there was a study that was published just recently talking about how if you have these conditions, and it was a retrospective study that looked back on 1 million plus people, and they found, and they even accounted for different risk factors, and they found that if you have these conditions, it's putting you at risk of heart disease. So why is that? What is the reason for this aspect of it? And as we know, it's not cholesterol that causes heart disease. And your arteries are a muscle, right? They're not a pipe. And how they actually get, how they undergo the plaque building process is a lot different than how we think it is. Remember, it doesn't clog up like your kitchen sink pipes. And so if we understand that the arteries are a muscle and not a pipe, we know that there are infinite number of markers that can affect the inside lining of the arterial wall. Infinite number of markers. Psoriasis, arthritis, rheumatoid arthritis is another one, but psoriatic arthritis, these are all factors that can affect the inner lining of the arterial wall. And there are infinite number of markers that can affect the arterial wall. All results down to 3 finite responses. And the 3 finite responses are inflammation, which explains, so I'll get to the other ones in a second, but inflammation explains the arthritic, because arthritis is an inflammatory process inside the joints. And so that explains that part of it. But there are 2 other factors that I think get ignored, actually quite extensively ignored in our healthcare system. And number 2 is oxidative stress. It's like biting into an apple and leave it out on the counter. That's oxidative stress. And number 3 is vascular immune dysfunction. And when we talk about immune dysfunction, this is where then psoriasis can come into play, because it's kind of an autoimmune disease, and these are autoimmune diseases. And it makes sense that if you have these conditions, that is putting you at risk of heart disease risk. So what can you do? Well, make sure you watch my video on cardiac tests, but more importantly, go to our website, look for more information on cardiac testing, because it's important to how to navigate the healthcare system to find out your cardiovascular disease risk so that you can reverse the disease risk before it becomes a problem. Any questions, comments, or observations, I welcome them as always. Make sure you hit the subscribe button above, and we look forward to helping you